Hi, everyone, and welcome to Better Minds channel. As mental health professionals, we really want to destigmatize seeking help and getting your questions answered. These chit chats offer a way for not only for you to get to know us, but to hear about topics we are so passionate about when working with our clients. So, I'm Brittany Webb, the founder and a licensed therapist here at Better Minds Counseling and Services. I'll have more about our information about the practice and about both of us below today. But I really want to take a moment to introduce Erik Osterlund, also from Better Minds Counseling and Services, who is an associate licensed therapist and our group therapist. Erik specializes in anxiety disorders, depression, borderline personality disorder, and OCD. I'm excited for Erik to expand on OCD today. And really, what we're talking about whenever it comes I guess with OCD, maybe it ties into a little bit with anxiety we can use this with, but when we're in between sessions and inventing your own exposures, I think is really, really awesome. So, right, like a key part to ERP or exposure and response prevention, really, right, like exposure is right in its name. Um, it's which is helpful for not just OCD, right? It's also for anxiety when using like ERP or exposure kind of therapy. Tell me more about exposures and more about the importance of maybe like utilizing this outside of sessions.
Yeah, that's a great question. And, with exposure response prevention, a lot of the times you do exposures with your therapist while you're in the session. And, it's really important to also find ways to engage in those exposures between the sessions. The reason this is important is because that exposure response prevention, it allows you to start to get used to some of the anxiety that leads to maybe instances of avoidance in your life. And if we're engaging in exposures between sessions, we're constantly sort of challenging our anxiety, putting ourselves in places where we're experiencing some discomfort. And, if we have this idea of consistently approaching anxiety that we feel like is manageable between sessions, you'll start to see progress really kind of start to pick up, or maybe, kind of a reduction in like the sort of intensity of the intrusive thoughts and building up some of your distress tolerance. But it can be hard sometimes to know how to go about doing between session exposures.
Yeah, I think that actually leads me to my next question of like, it is challenging to maybe come up with your own exposures to do, but how would someone know if the exposure that they're doing is essentially like not right?
Yeah. Two things come to mind. If an exposure isn't doing its job, um, first of all, I've had, especially when people start out, sometimes they're really eager to start exposures. So we'll talk about building the hierarchy, and we're talking about exposures that are kind of a wide range where, maybe we have like a little one over here where it's like, maybe I do my dishes without washing my hands afterwards. And, we're also talking about maybe these bigger ones that are harder to do where, maybe it's like resisting washing your hands until before you eat, and it's just touching everything around you. And, that leads to a lot of anxiety. And just because we talked about that exposure doesn't mean that's the one to go and do. I think, allowing that time for the process of the hierarchy to be built up a little bit is, essential in kind of building insight into knowing, if you're feeling the right anxiety from an exposure. Um, and the other thing that comes to mind is more specific to maybe like the harm or morality or existential subtype of OCD. Because within this subtype, because of the content of the thoughts, sometimes it can lead to more feelings of depression than anxiety. And if that's the case and you're feeling more depressed from an exposure than anxious, then that probably means that there's a better way at processing through or tackling that obsession or compulsion.
Hmm. I think it's challenging, right? That you don't, as eager as we all are to move through something, that jumping to the highest kind of rating, or our kind of like highest score with it, is not to the exposure that's like outlined, is it's not really beneficial, because that's kind of what's already been happening before going through this.
Yeah, like we want to expose yourself to anxiety, but we don't want to get to the point where we're flooding the anxiety and causing panic symptoms. Like that's kind of another indicator that maybe an exposure, it might be a little bit too difficult, and that might be something you bring to your therapist and say like, "Hey, I tried this exposure out. It was a little too difficult," or like I couldn't, even get to the point where I was able to resist the compulsion. That's a good indicator that maybe we need to break that down and find a middle ground to kind of ease our way back into that exposure.
Mm-hmm. Absolutely. So then I think, like, what are some examples of exposures you've seen your clients create?
Yeah. Exposures, they can really be all over the place. They become very specialized to you once you get into that sort of form of treatment. And it really kind of depends on which subtype of OCD that you have. But for example, with the perfectionism subtype, we might have exposures. There's a lot of the times, rereading, checking emails, making sure I didn't make any mistakes, making sure I'm, relaying the message how I want to. An exposure that we've created in the past is, writing out an email and sending it without checking. And there's layers there when it comes to inventing your own exposure. You can think about like the frequency and the consistency of, how long do you want to be doing this exposure? How often do you want to be doing this? And we can change the difficulty just even by changing the expectations for resisting the compulsion. So, for people who have a compulsion maybe that's just right and it has to do with turning things on and off or tapping things a certain amount of times. Um, Exposures with that can even be just messing up the amount of times that you tap by doing it one more than what your OCD is telling you, or doing it a couple of times less. That can be another way to kind of get another ring in the ladder, and making some of those exposures.
I like that. Like, it's kind of can be small. Well, we say small, right? Quote unquote small, like little like adjustments to have a little bit of that uncomfortability to challenge that OCD, really.
Yeah.
Mm. So I guess when working on inventing, if someone's working on this of like inventing their own exposures, is it important to work with a therapist too?
Yeah. I think it's really important at the beginning of the process, especially because a lot of people hear exposure and they're just like, okay, that just means I have to do the opposite of what I've been doing. And that seems like a lot and it's very overwhelming. And it is. And that's not what therapists are going to ask you to do. And I think it's really important to lean on that therapist support and structuring out your hierarchy, building insight into, how this OCD operates, because it can be very irrational. There can be a lot of embarrassment behind some of the irrational thoughts. And, therapist helps get you to a place of understanding that, this is how OCD operates. And, once we get into the exposure process, when it comes to doing exposures between sessions, I find that there's kind of two camps of people. There's people who come in and they kind of take every exposure and they maybe try to do a little bit more and maybe sometimes overextend themselves a little bit. Um, and we don't want that flooding situation to happen. So um, I always tell my clients, like, if you find yourself in a situation where an intrusive thought that we're also working on in an exposure is coming up, if
Mhm.
you check in and, like if you're using a 0 to 7 or a 0 to 10 anxiety scale, like check in with your numbers, know your limits of, about where I'm at in my hierarchy. Like, if you can withstand or tolerate a level 4 exposure and you feel like maybe in this, I call it like a pop quiz situation, you think if you resist that compulsion or resist that avoidance, it would give you maybe a similar anxiety rating. That's when I say, like, go for it. Like, try it out. The worst that can happen is that we learn a little bit more about the OCD and anxiety. So that's kind of the camp that's like, okay, ready and raring to go. And then there's another camp of people where, a lot of the times they're nervous to start. And so maybe they'll start to, like avoid some of the exposures at the start, or really kind of, drag their heels a little bit with some of the exposures. And so, they aren't doing as much between the sessions because they're almost waiting for the therapist to give permission to start that next exposure. And I think that's where we can, find more client autonomy and, engage in some of those things between sessions, because it helps promote that self-confidence and that trust in yourself. And it's a really good practice in kind of understanding your limits, because sometimes we approach an exposure or a situation expecting a certain amount of anxiety to happen. And sometimes it's less, sometimes it's more. But a lot of the times when it's a situation out in the real world and not really a structured exposure, it can go either way. And just knowing that you have coping skills and, building up that foundation before you get to the point where you're, trying to apply some of this knowledge between the sessions.
I love that. I think that was a great distinction between, like what can happen for, if we have like two individuals who's going through, let's say, contamination OCD, right? And like they might experience that different in terms of like, if they're like ready to kind of like go for it and like find themselves in different situations and like ready to maybe challenge themselves, but then others are like waiting for that kind of permission for the next step, I think is also important to kind of see, because everyone's going to kind of approach this differently.
Yeah.
Um,
And it's about like finding that balance that feels right for you. And eventually, when you've done enough exposures and you know what the process is like, it almost sort of becomes more of like a mindset than just these little tasks that we check off throughout the day.
Absolutely. Well, I guess my last question for you is, what is something you'd like others to know about inventing and creating their own exposures?
Yeah. Um, so I'd like people to know that it is possible. You can invent your own exposures. And a lot of the times, like therapists will be excited to hear what you've come up with, and we'll support you in maybe tweaking it if it's not really giving you the anxiety that you feel you need. And as I was kind of mentioning before, I think having this idea of the exposure mindset, it helps you approach scary situations or anxiety inducing situations in a way that like promotes confidence. And, a lot of the times, the more we avoid things that scare us, the bigger and scarier that situation or that thought becomes. And by implementing these exposures and just having exposures as a process or a habit that you have in your life, it becomes, just like a part of your routine. And when you get through a lot of difficult exposures and you've played a little bit of the OCD whack-a-mole and have, maybe bounced around to different subtypes, you start to feel confidence because the skills work no matter what subtype it is. And I think that's the beauty of exposure response prevention, is that, it can feel like this is like I'm the only one experiencing this form of OCD. And the treatment would still be the same and it would still be effective. And um, when we're talking about between session exposures, the research shows that clients who engage in more of those between session exposures or do their exposure homework, they end up feeling that relief a little bit quicker, or like it lasts a little bit longer. So I know it's scary, and exposures and going to therapy to feel anxiety can sometimes feel backwards, but it's really like what helps get through these really difficult anxiety and OCD symptoms.
Yeah, and I guess it's really important to note that it's really about then seeing a therapist who really specializes in OCD, using ERP to work through the OCD symptoms, because it's challenging, because it's hard with, right, like talk therapy can reinforce some of it, but the exposures can, it's been so researched that it supports this kind of modality and this practice in it with using ERP. So awesome. Well, and I guess any resources that you have you'd like to share?
Yeah, so I am one of those resources. I specialize in exposure response prevention, and I'm also starting up a group for OCD, like a supportive space for people who have family members who are experiencing OCD symptoms. And if you're ever interested in learning more about exposure response prevention, or even just seeking therapy in general, you can click the link below and schedule like a free 15-minute consultation with me. I also offer a DBT skills group. So if you're interested in learning more about dialectical behavioral therapy, feel free to schedule that consult and we can get started talking about some of these services that we provide, and getting you to a place where you feel confident and better about what you're managing, what you're dealing with in your life. I'd also like to mention that I offer consultations for therapists as well. So if you're a therapist and you're getting into exposure response prevention or like to learn more about it, I'd love to chat about it. You can also, book with that consult link, and we can always talk more. But I really appreciate this conversation, and I hope you all learn something about creating those exposures and what it means to kind of engage in those between sessions.
Awesome. Well, thank you so much, Eric. I really appreciate it. This was really, I think, insightful with like how to maybe navigate these, like building your own exposures in between sessions or kind of on your own, and when support is really helpful during those times. So yeah, thank you. And thank you everyone for joining. And yeah, we'll have the resources below, and tune in next time.
Thanks, Brittany.